Welcome back to Renergy. This is Dr. Carolyn Bowers, your doctor of physical therapy. And this is the episode where you learn how it all began. Remember, Renergy is the blending of rehab work and energy skills and techniques. In 2020, I found myself working in an acute care hospital setting, treating trauma, med-surg, neurological, and spine patients throughout the day. Emphasis is placed on performing skilled PT services in the acute care setting to optimize functional mobility and to allow the patients to discharge from the hospital as soon as they are medically cleared. Often as therapists, we run into obstacles on a daily basis, preventing our patients from discharging in the standard length of stay associated with their admission diagnosis and/or procedure. We saw a large number of patients that were homeless, had poor family support, lived alone with no caregiver support, etc., complicating discharge plans. We never knew what challenges we were going to face on a day-to-day basis, but we were still expected to meet productivity and manage discharge plans, with our clinical case managers leaning heavily on our recommendations. It was overwhelming at times because we were responsible for mobilizing these patients with +1, +2 help, or +3 help. And it didn't matter how much equipment we have or had, we were still expected to mobilize these patients who were suffering from trauma, whether they had been admitted voluntarily for elective surgery or involuntarily due to an unexpected injury. During 2021, I was led to take a Reiki Level 1 class for physical therapists, and it changed the way I looked at energy work and its possibilities to help my patient move through their pain cycles that held them captive and frozen appropriately. Fortunately for me, I had a supervisor who understood energy work and was supportive in contacting the North Carolina Board of Physical Therapy Examiners to confirm where Reiki fell under our standards of practice as a physical therapist in North Carolina. The Level 1 certification allowed me to move forward using Reiki in my treatment sessions to assist my patients in optimizing their functional mobilization and so much more. Renergy, to me, and the purpose of Renergy for me, is that Renergy is a sacred approach. It was given to me from above. I was reminded that there are many tools given to us academically and professionally that we are not using to optimize our clients' rehab outcomes. We must consider their whole being to allow the nervous system to synchronize with the musculoskeletal system to maximize their success in rehab. Renergy will remove the old guard saying, no pain, no gain, that many clients and patients in our clinical settings have connected to physical therapy in particular, and physical therapists in particular. All rehab therapists, including occupational and speech therapists, can benefit from incorporating Renergy techniques to synchronize the nervous system and musculoskeletal system. For example, I have a book that I'm currently writing, which is called Sacred Rehab. And in this book, it shares actual physical therapy treatment sessions in the acute care hospital and private studio setting. The Renergy approach was used to optimize my patients' participation and their mobilization. By using all the tools available to PTs, OTs, and speech therapists, we can change how our clients and their caregivers' perspective of what rehab looks like today by enhancing their recovery physically and emotionally. Underlying emotions can influence a client's physical outcome, and Renergy positively impacts them both and causing no harm. Let me move on into my next segment, which would be called Tea Time. So what do I want to share with you all about tea time? Well, the one thing that comes to mind to me is from Nikola Tesla. And Nikola Tesla says, to find out the secrets of the universe, think energy, frequency, and vibration. So keep that in mind as you learn more about Renergy and the different approaches that Renergy will use to help you enhance your patient's outcome. Now let's move into our next segment, which is called ICU. Yes, the ICU that we see when we see intensive care unit. But in this episode, ICU is meaning that I see you. And I want to give a shout out to Maji Avance. Maji Avance has a business that she has created. It is at Healy Heal, Heal, University, YOUNIVERSITY.com. I have purchased some of her products, which are some shea butter creams and some other different oils in which she has, and also some nice bath salts in which she has created. And they're all created with a purpose and an intent. And I love the names of them. One of her shea butters is called Divine Feminine. Another is called Divine Masculine. And I love what she's doing. And she has such good energy. She also is certified in energy work. And she's found in the Winston Salem. And I'm just giving her a shout out and letting her know that I see you, Maji Avance. And keep it going. We see you. All right, guys. That's going to be a wrap for today. So please join me on the next Monday with a new episode where we'll be sharing specific patient interactions and their responses and outcomes of receiving Renergy. So see you then.